conceiving because due to so many reasons as the late marriages and the working women, they are struggling with the work and life balance and with the relations and all these things. So the rate of infertility are on rise. So I want to sort this problem out in a natural way.
Hello and welcome to another episode of Hall of Fame interviews. Today we have with us Dr. Bachaspati Dash, and he is working in Odisha, and he had a lot of struggles in his life, but he is a very good warrior, and he has come out of the struggles and he has won the legal cases also. And today he is here with us, so he is a fighter in true sense. So welcome Dr. Bachaspati, and congratulations on Hall of Fame.
Thank you.
To share some, how did your love for medicine start and why did you get into medicine?
Medicine actually is my passion, as my father was also a doctor. So it is a healing and curing somebody and getting relief from the pain and agony is definitely, that gives a lot of pleasure to me.
Why did you choose gynecology?
Gynecology is a very upcoming subject, and that all the modern latest gadgets are in use in even in genetic engineering, and everything is there. So that is why I have chosen this, because the future generation is most important for us to be healthy, happy, and free from any genetic disorders. And there should be, the genes should be totally good, and so that our future is secured and will be better.
We are working on a concept called natural IVF, right?
Yes,
Tell us something about
I'm
it.
working on a concept that is called the natural fertility. Means there is now a lot of, since the patients are facing the problem of conceiving because due to so many reasons as the late marriages and the working women, they are struggling with the work and life balance and with the relations and all these things. So the rate of infertility are on rise. So I want to sort this problem out in a natural way so that they don't have to struggle and find difficulties.
Because a lot of IVF centers are coming up in the whole part of the country. So what is your take on that?
Yeah, definitely the IVF center are doing something great, but the thing is, it may not be the ultimate only solution.
Right.
So we have to find some, as it is too costly, and not only costly, it consumes a lot of time and energy, and due to the repeated appointments it demands. So for the working and busy woman, busy couple, it may be putting a lot of difficulties. So I want to sort this out in a better way so that within their home, within their own convenience, they can sort it out this problem by having a little knowledge on that. And with the changes in the lifestyle and all that, we can go to the root causes nowadays. And I have research on that. We can go to the root causes and eradicate them so that they can conceive naturally.
What are the components of it?
It is basically balancing all the pillars of health. Basically there are 8 pillars of health. That is, it means not only, as we know in our, as per the WHO definition, there are 4 dimensions of health. Only just looking after the physical part is not just enough. So you have to see into the mental part also, mental health and social and spiritual health as well.
Right.
And in that also, in the physical health part, there are so many other things are there, like not only the food and nutrition, how you eat is also important. And not only that, rest, restoration and relaxation, that is also important.
Right.
And even the activities, exercise, they are also important.
Right.
So actually, there's a lot of imbalance and disturbances in all these things, like the coming up of the modern gadgets, and especially the mobile and the screen time is increasing, and the electromagnetic radiations and all those things are creating a lot of interference in the natural rhythm of the woman. So that is the basic cause of infertility. So we can go into I have researched a lot, and I've got so many testimonials also. Once we correct these things at the root level, so naturally they are ready to conceive naturally.
So you worked on many people for reversing the diseases like diabetes also. How can you do that?
Diabetes is basically it's a disorder of energy. Metabolic disorders means mainly energy metabolism. especially it narrows down to the carbohydrate metabolism, basically.
Right.
Once we master that, once we balance the calories or reduce on the carbs, and with the patient education, it can easily be, it's not a rocket science at all now.
Okay.
Reversing diabetes is nowadays with the all the science behind it, and it has become so easy. So only thing is that many doctors, even diabetologists, they don't put much of the emphasis on the lifestyle, rather on the drug or the medicine part.
Right.
But actually, the medicine is just a calorie balance and the carbohydrate metabolism part. Is if we can do that, and as well as the activity and the things which cause insulin resistance, those factors we have to go into that, and if we can correct it, we have to reduce the insulin resistance and increase its sensitivity. That's the best way how we can ultimately reverse the diabetes.
So the natural this thing conception that you're talking about, your patients, do you advise the alternative medicine or yoga and pranayama and all these things? Or is it only the lifestyle one?
No medicine. I don't believe in any medicine. Though even some herbal or natural
Yeah.
medicines, they are also of help, and rather they are having lesser side effects. So adverse effects, so that we can also add them. Like so many things are there, like some even Ayurvedic preparations are there, and some herbs are there. That also we can take help of that also. But main thing is this balancing the pillars of health, and especially the activity part. And this activity exercise, even the balancing between the sympathetic and parasympathetic nervous system, we can in that way we can reverse the diabetes. Not only that, we can even some other chronic diseases like even obesity and others of the even the thyroid issues or other endocrine issues and the gut issues, that all of those things can easily be reversed.
Right. So you had a very tough time in between, and then you come out of it. So you want to share something about that?
Yes, myself actually I was suffering from 4 5 diseases almost 4 5 years back. Gradually, I was able to overcome them one by one. Like I was over, my weight was 105 kgs, and
Okay.
having my height is just 173 centimeter or 5 feet 8 inches. So as I was overweight by almost 30 kgs. So out of which I have reduced 25 kgs, and still I have got 5 kgs left to be reduced. That also, and I was suffering from diabetes, also type 2 diabetes mellitus, and that also I was able to reverse. Once upon a time, I used to take insulin after taking 3 medicines, metformin for some time. For a short period, I was on insulin also.
Okay.
Gradually, I could reverse it. I could gradually reduce and do that. That also, not only that, I had kidney stones also.
Okay.
That also I could get rid of, and I used to get bouts of gout also when I was in state government job. Due to the heavy pressure, work pressure, I was suffering from insomnia and even depression also. I am now all able to get rid of all these things, and I'm leading a very happy and relaxed life now.
Great.
So I want to impart the same benefit to the millions of people who are suffering from all these things. So we can that can lead to a better society. Means
Right.
we can reduce the disease burden, and ultimately the productivity can be increased, and we can even boost the um, economic health of the not only the families of these, even the country also in that way, and
Cool.
save many
You got
precious lives can be saved.
fantastic. So you have got your niche and you have got your branch now. You are enjoying your work.
Yes, yes.
Yeah. And do you want to tell something about your court case thing also? What happened? What went wrong? And how did you learn from that?
I was wrongly actually put into a case regarding ultrasound, and the machine was just kept as a demo. It was sealed, and it was I had applied for its registration, but it got delayed. In the meantime, the demo machine came, and the same was seized by the people, and they didn't realize that the machine was not mine.
Okay.
Gradually, in the later on stages, they realized that the mistake was not mine, and ultimately I was freed from the conviction, and now
That must be stressful, right?
yes, now I'm free from all that. So it caused these cases. They cause a lot of depression and a lot of defamation also as a doctor.
Yeah.
So that a dent in the reputation, that's a big thing to the doctors. So that fortunately, with the grace of God, I am out from that also, and hope now at this with all these experiences at this age, I'll be at the service to the community in a better way with all these experiences. So I can be of help to the millions of patients who are suffering from all these chronic diseases. So I hope with the help of the Doctorpreneur Academy, I'll be able to cater to the masses using all these techniques like this digital coaching and with your help. So we can do something great and something to the community, and we can even we can create a revolution in the approach of the medical treatment, because I found there's some missing links in the healthcare, like preventive and promotive healthcare is missing. So we can incorporate that, and there's people who are suffering and really having a lot of agony and pain. Not only that, of the financial stress which they are facing due to all these things, we can eradicate that with your
Sir, I
help.
think you're a real life hero. Because you have fought the battle, and there are so many people who get depressed and take wrong steps, but you have fought it out, and now you're re-establishing yourself in a very, very nice way. I really appreciate and honor your work that you have done, and I really appreciate that you're working in a like a newcomer, you're again with full of zeal and full of energy and working to reverse the diseases which are not possible to cure.
Thank you.
So how long you have been with our academy?
I have been in the academy almost, I think, even not 1 year, means 5, 6 months. But
Okay.
due to my busy schedule and all that, the other courses also, I have not gone in depth into as a diamond member into the Doctorpreneur Academy. But
Okay.
I'll go through it, and what I found it is the best course available for the doctors right now
Okay.
in India. I don't know what is there in abroad, but in India, as far as I know, as a senior doctor of more than 35 years of experience, so this is the best course for the doctors. And I feel that many young doctors should join here and come, and we can make ourselves first healthy and happy, because
Right.
many doctors are suffering from when
Problems.
compared to a normal community,
Yeah.
the doctors are more suffering from various diseases
Yes.
like diabetes, obesity, hypertension. And
Absolutely.
all these. So first we'll make the doctor communities healthy with the
Healthy.
help of your Doctorpreneur Academy.
Yeah.
I think you can give me that part to me also. Means
Yes, sir.
how to make the doctors healthy first.
Yes, we will happy to do that because somebody is thinking about doctors. That is to be appreciated.
So we'll definitely go for it.
Definitely. Thank you for giving your time and your nice thoughts. One last question I want to ask that what is your message for the newcomers, new joinee in the gynec department? How should they plan their career?
In the gynec department, first of all, they should come up with a lot of vigor and zeal and interest, because this is a field, this is gynec obstetric is such a thing. It combines everything. It is not only all the diagnostic, all the latest technologies are there, like MRI and all these things you have to use, like ultrasound is like your stethoscope.
Right.
Without ultrasound, you can't do, and has progressed so much. Like earlier days, the Doppler was a dream, but it's a commonplace. So
Yeah.
the latest generations of ultrasound, like third and fourth generation with the 3D, 4D, all those things, and along with all the latest gadget, MRI, and all these things, we can use in this. Not only that, the field of genetic engineering and those things are coming up like anything. We can have a designer baby also, in maybe in future. So we can
Right.
map everything. We can do anything, and everything is possible in this branch. So it's a very futuristic, and that is why again the problems in this field are increasing due to the lifestyle. The infertility problems are increasing, and the other issues are also increasing with those working mothers and all these things. So that is why this has become, and that too because everybody is wanting going for a small family. So every
Yeah.
pregnancy has become precious. So that's
Yeah.
why only thing is, since a doctor here has to take a little more risk, so people are afraid of that, but they should not be. They take it. You can, if you put your best outcome will be there. So nothing to worry.
Very well said.
Best for the newcomers.
Very well said.
Best wishes.
So this was about Dr. Bachaspati Das. He has been a warrior and he will remain a warrior. So best of luck for your future, sir. Thank you so much for sparing some time. And if you want to understand how we are working and helping these doctors, then you can join the link below, which is for our webinar, and attend the webinar and be a part of Doctorpreneur Academy. Thank you, sir. Thank you so much.
Thank you. Thank you. Thank you.
Thank you, sir.